Hi, my name's Paige and I'm a chemotherapy sister, and today we're here to talk about mouth care. You'll also be hearing from Mariam, who experienced some mouth problems while on treatment. Some cancer treatments can cause damage to the lining of our mouth and our throat. This can cause ulcers, pain and discomfort, which is known as mucositis. You can get infections in your mouth such as thrush, and this can look like white spots on your tongue. Please let your cancer team know and we're able to prescribe some medications to aid this. Any damage to the lining of your mouth is usually temporary, but can sometimes be permanent. Your cancer team will be able to prescribe medicines to help with this.
Hi, my name is Mariam and I was diagnosed with Hodgkin's lymphoma in November 2020 when I was just 18 years old. So when I was initially diagnosed with cancer, I discussed with my consultant and I was told that I was going to be administered a combination of chemotherapy. I was given chemotherapy over a course of 4 rounds, and this was over a period of 4 months. During my chemotherapy, especially during my first 2 rounds, I really struggled with mouth sores.
Keeping your mouth as clean as possible during your treatment will help to prevent or reduce side effects in your mouth. Mouthwashes can be very soothing, but many of the ones available in chemists or shops may be too harsh if your mouth is feeling sensitive or sore. Mild saltwater mouthwashes can help reduce soreness. Add 1 teaspoon of salt to a small glass of cold or warm water, rinse this around your mouth, then spit it out, and then rinse your mouth with plain water. If your mouth pain is getting worse, your cancer team can prescribe a numbing gel or mouthwash to help. You may be advised to see your dentist before you start treatment. They may recommend using a high fluoride or non-foaming toothpaste during your treatment to help reduce any soreness. Use a soft toothbrush to clean your teeth gently. If you want to use dental floss, check with your doctor or specialist nurse first. If you have a low platelet count, flossing can make your gums bleed. Avoid using toothpicks when cleaning your teeth. If you wear dentures, soak them in a denture cleaning solution overnight. Leave them out for as long as you can during the day to prevent them rubbing against your gums. If you're having radiotherapy to the jaw area, you may be advised to keep your dentures in as much as possible during the day. This helps to maintain the shape of your gums. Your tongue may feel like it has a layer of film or coating on it. This can make your food taste unpleasant and put you off eating. A bicarbonate of soda solution can help to clean it. Bicarbonate of soda is usually available from your chemist or most supermarkets. Dissolve 1 teaspoon of bicarbonate soda in a pint of warm water. Use a soft toothbrush or gauze dipped in the solution to clean your tongue. If this does not help, talk to your cancer team because you may have oral thrush and need medicine. If you are having radiotherapy for head and neck cancer, brushing your tongue is not recommended. Your clinical nurse specialist can give you more advice.
One of the main side effects I suffered from during chemotherapy was oral mouth sores. It's really important during this time to have good oral hygiene. I used to brush my teeth every morning and night and after every single meal. It is recommended to use a soft toothbrush like this. I also used a salt water solution and used to rinse my mouth with this after every single meal and also morning and night.
Radiotherapy to the head and neck area and treatment with some cancer drugs can damage the saliva glands. This may cause a dry mouth. It may sound obvious, but taking regular sips of water can help keep your mouth moist. Keeping a glass of water by your bed and carrying water with you when you go out. Sucking ice cubes or lollies and chewing gum can sometimes help you to produce more saliva. Try to avoid alcohol, including some mouthwashes that contain alcohol. Do not smoke or vape, as this can irritate your mouth and make it feel more dry. Tell your doctor if you are having a dry mouth. They can prescribe mouthwashes, lozenges, artificial saliva sprays, gels, or tablets if needed. Use a lip balm to protect your lips, but it's more important not to use anything on your lips during radiotherapy treatment. Speak to your clinical nurse specialist or radiotherapy team about this. Even if you don't have a dry mouth, drinking plenty of water and helping to keep your mouth moist can reduce problems. Avoid fizzy drinks because these may sting your mouth, and instead try milk or milk-based drinks, milkshakes and hot chocolate. These can be from dairy such as cow's milk or plant-based alternatives such as soya, rice or oat milk. Very hot or very cold drinks may irritate a sore mouth. Some people find drinks that are lukewarm or at room temperature more soothing.
The hospital used to give me a nutritional drink and add ice cream to it, and I also used to drink that with a straw, and I found that really helpful just to be able to get something down me. When the mouth sores weren't as bad and when I was at home, we used to manage it at home by having foods that were quite soft, for example like jacket potato, soups, but I'd steer away from spices and fizzy drinks and just generally anything that would make it feel worse.
Depending on what mouth problems you are having, such as a dry or sore mouth, and what you like to eat, we have lots more information about what you can do at home that might help. Things like eating soft foods if your mouth is sore, or adding sauces to dry foods if you have a dry mouth can also help. For more information, visit macmillan.org.uk or call the support line on 0808 808 0000.